There are 3 bones there. Are they right or left?
Right.
That's a left.
That's a left. How do I know that's a left? Okay, well here's my hip joint. That points out. Then you have to sort of orient yourself this way. This bone's up. This bone's my butt. This is my pubic bone. The other way to do it in real life, let me borrow your hip. In this context. Yeah. So the other trick is, if you hold up a hip bone, there's this big notch. You can put your thumb in and use like a telephone.
Nice.
So yeah, and that would actually be anatomically correct like this. You can also wear it like a mask. So that would be the correct orientation.
Can we see that?
Your nose is in your pubic bone. Insert joke now, right? So thumb in there, and like that. If you do this, that will help you know that this surface is your auricular surface, meaning it's your ear. So your ear goes on the auricular surface, your thumb is in there, and it's called the obturator. Obturator. So it all works out. But this bone is that.
I'll remember this now.
Yep, that's just like that. So that would be here. So let's go through our bones. Name the one on the top. Which one's the big hippie bone up there?
Crest. Iliac.
That's your ilium. Put your hand on your ilium. So you're supposed to name the auricular surface, which is where your ear would go. That's the in here. You're supposed to name the sacroiliac joint. I wonder where that is. That's between my where and where. Sacrum.
Iliac.
Right. So the auricular surface goes onto the sacroiliac joint. Then how about an iliac crest? Yeah, that's the big ridge that you think of as a hip bone.
So on that side,
It's
that, yeah.
yeah. Arcuate line, you're going to have to trust me, there's a line on the inside. You can't see it very well in the plastic one, but there's a line there I'll show you on a different picture. Then we have the notches. So you put your thumb in the great sciatic notch. That's where your thumb goes to make the phone. That's where your sciatic nerve would go. Then we have an iliac fossa, which is the cup. Then we have spines. So now the thing about the spines is you got to make sure you know front and back. So this bone sits in me just like that. So this side is anterior, this side is posterior. So this bump here, where I'm pointing with my finger, would be which one?
Superior anterior spine.
Very good. Superior anterior iliac spine, or anterior superior. You can flip them around. This one here would be which one?
Inferior
Anterior inferior. This one back here would be?
Posterior superior.
And this one here?
Posterior inferior.
Very good. So you have 2 here and 2 here. So make sure you know this is front, this is back. So you have to know all 4 of those words together. You can flip the anterior superior words around, but make sure you put a front and a back, an up and a down, and an iliac spine. Where's your ischium?
At the bottom
What you
part.
sit on? You sit on your ischium. You sit on your butt bone. That's this rounded one here on the back. So you're supposed to know the tuberosity, that is that big bumpy thing inside your butt cheek. That's this big, that's a big potato. That's your ischial potato. Ischial spine is that thing inside, you can't see in the picture, but it points down toward your insides. That's your ischial spine. Then we have a lesser sciatic notch, which is this little one here. And then the ischial ramus. Where was a ramus? What was that?
The arm like that.
Yeah, that's right here. That's the ischial ramus, the flat part. The front bone, which one's the front one?
What do you mean?
That's going to be the pubic bone. The crest is the top. The symphysis is the middle. Right? Tubercle is a little potato, and the ramus is the flat part. So you know some of these words already. So I have my pubic bone here, my ischium bone here, my ilium bone there, making up the coxal bone here. Make sense? But wait, there's more. The big hole right here, where my eye would be, that's the obturator foramen. So you see obturator, that reminds you of the phone. That's that big hole. Okay, the acetabulum. Which one's the acetabulum?
Where the ball of the
Hip joint. Vinegar cruet in Latin. That's the acetabulum, is the hip joint. The inlet, outlet, arch, and bones we'll talk about when we do male versus female, which I'll grab that model. These your hips? Okay. We'll go do this model.